بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه وسلم أجمعين. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا يا كريم. إن شاء الله في المحاضرة دي هنتكلم على دور الأشعة في تشخيص المرضى اللي هم عندهم فيروس كورونا. يمكن حضراتكم تذكروا إن إحنا لما اتكلمنا في المحاضرة بتاعة الديفيوز لانج ديزيز قلنا إن إحنا عندنا جراوند جلاس باترن، وهو أحد الباترنز الجديدة اللي اتضافت على الأربعة القدام، وفي الوقت اللي احنا فيه بقى هو المتصدر الباترنز في الأشعة زي ما هنقول دلوقتي. الجراوند جلاس زي ما احنا قلنا معناه ان اللنج مغبشة او زي الازاز المصنفر يعني، وفي فترة طويلة ما كانش يعتبر diagnostic sign ولديزيز معين، وكانوا بيقولوا إن ده هو subradiological term، ومستنيين إن هو يتحول إلى interstitial أو alveolar pattern فنقدر نعرف إيه هو ال underlying pathology. و this is the appearance of the ground glass pattern، اللي هو معناها إن في increased attenuation of the lung parenchyma، ولكن البرونكوفاسكولار ماركينجز شايفين كويس through the opacities. في زمن قديم كان الجراوند جلاس باترن يعني واحد من اتنين: إذا كان البيشنت ده هو عامل أو عنده history of lung transplant then ground glass pattern means that the lung is rejecting. أما إذا كان المريض immune compromised، بالذات لو كان عنده AIDS، فمفكر إن ده يكون نوموسيستس كرينياي اللي هي اسمها دلوقتي نوموسيستس جيروفيشي. لكن في الديفرنشال diagnosis الجديد بتاع الجراوند جلاس pattern we have divided this pattern into two types: the acute type and the chronic type. And in the differential diagnosis of the acute type, there is the pulmonary edema, the pneumonia, especially the viral type of pneumonia, and this is very important. Some cases of pulmonary hemorrhage and cases with acute eosinophilic pneumonia. Then the clinical appearance of the coronavirus infection include most commonly fever, then cough, then fatigue, then some sputum, and shortness of breath. And less common presentations include myalgia, arthralgia, headache, sore throat, chills, and pleurisy or pleuritic pain. Then this virus is known first as one of the series of SARS viruses, but now it is known as the COVID-19. 19 refers to 2019, the year where it is being discovered and became well known. Then some of the laboratory findings that can be seen in patients with coronavirus infection include lymphopenia, increase in the prothrombin time, increase in the lactate dehydrogenase, and the elevation of the inflammatory markers, sometimes seen in the blood. Then the virus spreads by respiratory droplets, by sneezing, by coughing, and by contact with the infected surfaces. The viral load is very high in the early stage of the disease. And the incubation period, as all of you know, is about 14 days. Now, the PCR test is considered very specific but of lower sensitivity, and this means that some of the patients will have negative PCR test and they are infected by the coronavirus. And this emphasizes the role of CT, which is considered now an alternative to the PCR test to spot some of the patients having this disease. But unfortunately, some of the patients, especially in the early stage of the disease, will have negative CT findings. The available imaging modalities are the chest X-ray, which is relatively insensitive to the early detection of the disease, the CT, which is the best way for evaluation of patients suspected to have coronavirus infection, and some recommended to inject contrast material if you are looking for the pulmonary vascularity. MRI, of course, has no role, and also PET scan has no role. Ultrasound is a very good imaging modality, provided that the one who is handling the probe is competent. And of course, because of the huge number of patients, there are a lot of cases presented on the internet everywhere in the world. And this is a patient with positive PCR test for coronavirus infection, and the chest X-ray is almost within normal limits. But the CT scan shows the typical ground glass configuration or patchy opacities, which are usually located in the lung base in particular. Another case with the chest X-ray, and he can only see some of the basal opacities in the lower lung lobes. And this is the follow-up chest X-ray 2 days later. If you see marked deterioration of the patient condition or of the X-ray findings in a very short time, then you can suspect the possibility of coronavirus infection from the chest X-ray. But this is a case where you can see the chest X-ray, which is within normal. This patient is complaining of fever and odontophagia. He has been in Italy 7 days ago before this chest X-ray. And the chest X-ray at that time showed almost normal finding, but 12 hours later, there is extensive opacities in both lung fields. Then 3 days later, there is marked deterioration of the imaging findings. And as I have mentioned, ultrasound is one of the best imaging modalities for rapid evaluation of the chest, provided that the one who is handling the probe is competent and efficient in this particular area. I mean, imaging of the chest. Then these are the basic CT findings in patients infected with coronavirus. Most commonly, you got ground glass opacities, which are mainly distributed in the lung bases, and they are usually bilateral, and they are usually posteriorly located. Then they involve multiple lobes. They are peripherally distributed adjacent to the chest wall, and later on the disease you may get true consolidation, which is exactly similar to pneumonia. This is the evolution of the disease over days. In the early stage of the disease, which is between 0 to 4 days, you got ground glass opacities and some crazy waving opacities I will show. And from 5 to 8 days, the ground glass opacities increase. From 10 to 13 days, you got parenchymal pulmonary consolidation similar to pneumonia. And after 14 days, you got gradual resolution of the disease. And this is one of the typical, let us say that, the typical distribution of ground glass opacities in both lung fields. You see the peripheral distribution, you see the posterior distribution, you see the distribution in the lung bases. Another example, patchy ground glass opacities distributed everywhere in the lung. Mostly they are peripherally located and towards the lung bases. Rarely you got what's known as the crazy paving, which is similar to the opacity seen in alveolar proteinosis, where you can see hexagonal opacities within the lung fields, and this is considered a late stage of the disease. Also, the presence of traction bronchiectasis means that you are somewhat late in the disease. Then some of the software programs can now calculate the extent of lung involvement in each lobe of the lung, and this may help to estimate the degree or the stage of the disease itself. And this is a proved case with coronavirus infection, showing the classic distribution of the disease of the ground glass opacities throughout both lung fields. Then you have 4 stages of the disease. The early stage, which is which indicates the first 4 days of infection, where you got the normal chest X-ray, and also you may got normal CT scan or some of the ground glass opacities. After that, from 5 to 8 days, you get ground glass opacities, and from 9 to 13 days, you get consolidation, and then the clearance stage. This is an example. There is extensive opacities which are seen in the chest CT done 5 days after appearance of the symptoms, and this chest CT done 19 days after the symptoms showed, of course, there is evident clearance of the disease. And this is another patient with an initial normal CT scan of the chest, then patchy ground glass opacities, then extensive ground glass opacities, then the start of the clearance of the opacities. This is the sequences of the disease in most of the cases. And it is not usual, and the CT scan to detect mediastinal lymph nodes, or to detect pleural effusion, or to detect 3 on-body opacities, pneumothorax, cavities, or pulmonary nodules. The most important finding in the CT scan is ground glass opacities, which are seen as early as 8 days in the disease. After that, you got too much consolidation in the lung. Then this is recommended by some of the authors, how to write the report, the CT report of a patient with coronavirus infection. Then you should emphasize the duration of complaint in days. then the distribution of ground glass opacities, or if there is consolidation, they are peripheral or central, posterior, the shape of the opacities, the percentage of lung involvement, of course, arbitrary estimation. Then, is there any fibrotic bands? What about the vascular markings? Is there any pleural fluid or lymph node enlargement that I have mentioned before? And this is an example where you can see the degree of involvement of the lung fields by the coronavirus. You can see here the classic appearance of the ground glass opacities, which are peripherally distributed, and they are more towards the lung basis. Sometimes you got telectatic bands and some of the bronchiectatic changes as well. Then, and this is also another example of a patient with coronavirus infection, and it shows the CT scan shows the distribution of the ground glass opacities, and you can see here they are usually ill-defined and they are patchy, rarely to be in the form of nodular opacities, as you can see here in this particular case. Then it's important to notice that the incubation period in children is about 2 days, and there is a series mentioned by the Italian literature of involvement of the children in about 1.2% of the population infected by the virus. This is very important, several negative tests, PCR I mean, are required in a single case to be confident about excluding the disease. And you know that some of the well-known patients had 2 or 3 PCR tests that were negative, and in the fourth one, they became positive. This is very important. And this statement is also important that the CT findings have been used as a substitute diagnostic test, and many of the patients are not able to perform the PCR test, then they may resort for the CT scan to look for the lung. But be careful that CT scan is not a screening tool. And some of the hospitals, when you got too many of the workers there, want to have a CT scan to be sure that he has not been infected by the virus. And this is a wrong policy. Actually, you may have the CT scan if you have symptoms. And this CT scan is helpful in the diagnosis. Then the complications of coronavirus include acute respiratory distress syndrome, acute cardiac injury with myocardial ischemia and even cardiac arrest, secondary infection by bacteria, sepsis, and multi-organ failure. As I have mentioned, that PET-CT has a limited role in the diagnosis. CT is quite enough. If you see patchy ground glass opacities, these opacities are full of inflammatory reaction, and you expect that by PET-CT they will show some uptick. Then what to do? For individuals, meticulous personal hygiene, avoidance of large crowded environments, self-isolation when necessary. Self-isolation is a good policy nowadays, even if you don't have symptoms. Be careful in dealing with others and try as much as you can to be more or less isolated. Then, for healthcare facilities, hard efforts for rapid diagnosis. This is very important. If you diagnose the virus in an early stage, you have a good chance of recovery. Then quarantine of the infected cases and effective supportive therapy. Actually, there is no known therapy for the virus until now, but we usually use the regular measures which increase the patient immunity, like adequate sleep, adequate feeding, some supportive measures, some antiviral therapy. Sometimes you need mechanical ventilation in patients suffering from severe respiratory distress or severe dyspnea. Then you should know that non-steroidal anti-inflammatory drugs are absolutely contraindicated. The differential diagnosis will include the differential diagnosis of acute ground glass opacities, which, as I have mentioned before, any viral illness, including HIV pneumonia, and a typical bacterial pneumonia like mycoplasma, pulmonary edema, cryptogenic organizing pneumonia, chronic acute eosinophilic pneumonia, and rheumatoid arthritis associated pneumonia. These are the pneumonic cases and also included in the acute ground glass opacity, the patients with pulmonary edema. But in the current days, there is no need to go into the differential diagnosis. If you see a patient with ground glass opacities, acute symptoms, you consider it coronavirus infection because this is the most common infection nowadays. And you do not need to go in a big list of the differential diagnosis. This is a physician presented by fever and sudden onset of dyspnea, and the PCR confirmed coronavirus infection, showing the typical appearance of ground glass, peripheral, lower lobe, bilateral, and so on. Then, if the PCR is negative, consider coronavirus infection. Then, if you consider this, the patient should isolate himself and you also should isolate yourself. And this is the coronal images where the patchy ground glass opacities are clearly identified. This patient had fever, cough, and breathing difficulties for about 10 days. 10 days is a little bit late presentation, and we got the changes in the plain X-ray like patchy areas of consolidation. And here you see the patchy areas of ground glass opacities, and the patient was proved to be positive for coronavirus infection. And this is the chest X-ray of a male 75 years old presented by dyspnea. And you get the chest X-ray showed extensive patchy opacities in both lung fields. The CT scan showed bilateral extensive opacities. And I think that this is somewhat late presentation of the coronavirus infection. And here you see this male patient, 50 years old, with breathing difficulties and dry cough. The blood test showed lymphopenia, which is one of the findings, and the chest X-ray was normal. But 4 days later, there are a lot of opacities in both lung fields, and 5 days later, one day after the previous one, and you got the same opacities. The 2 days later, and you got extensive pulmonary opacities. More marked rapid deterioration of the imaging findings is one of the supportive criteria of coronavirus infection. Thank you very much. Alhamdulillah Rabbil Alamin.